Hi, and welcome to our episode of Surgical Non-Surgical Showdown. Today we're going to be discussing the patient case. We're going to talk about how I would treat the patient surgically and how Madison would be treating the patient non-surgically. So let's jump right in. All right, so this is our first patient. We've discussed her previously. We know that she had come in for upper eyelid hooding, and I'd like to hear, Madison, how you would approach this patient, what you're seeing, and how you would treat this patient if she didn't want to do surgery.
Sure. So if she came to me and telling me that surgery wasn't really on her radar or what she was wanting to do, based on her assessment, I'm looking at her. Yes, you can see that she does have, some hooding. But what I'm really drawn to actually is that her right brow is sitting a bit lower than her left brow. So keeping that in mind, I'm also noticing that she has some lateral hooding of her eyelids. And that kind of tells me that actually her brows are not in the most proper position. So I'm going to want to focus on treating with neuromodulators, whether that be Botox or Dysport. I'm going to focus on the procerus muscle as well as the corrugator muscles. And then I'm also going to give her a small dose to the lateral brow of the orbicularis oculi muscle. And I might even consider doing maybe some sculpture in the temples to try and give more of an illusion of a lateral lift of that tail of the brow. When it comes to neuromodulators, though, I would want to be really cautious with the frontalis, whether I avoid it completely or go really light just to not further drop the brows.
Okay. So Madison's general approach is to, again, inject the areas that are pulling the brow down, to avoid the frontalis or the forehead muscle, to really allow that patient to lift their brows up, and maybe doing some volumizing in the temples, which can help lift and support the outer brow as well. Again, just volumizing, not addressing the upper eyelid hooding, but trying to alter a little bit more of the brow position itself. Is there anything you could do for the upper eyelid extra skin in this patient?
Not really, not necessarily. As far as skin goes, it would need to be taken out, whether that's more your realm surgically.
Okay. And what we had done, we discussed previously, but I did an outer brow lift. It's a small incision back by the hairline to lift the brows, give her a little bit more symmetry, followed by taking out some of that extra eyelid skin, which we were able to produce the surgical result. All right, so we were able to see that Madison has certain tools in her toolbox that she's able to use to help elevate the brows. Again, very different results that we're discussing. Madison's doing something more relying on the body's ability to lift the brow, to weaken some of the muscles that are pulling down the brow, and maybe even volumize a little bit in the temples to help lift the outer corners of the brow. Surgically, what we're doing is we're just lifting the outer corners of the brow, and we're taking out some of that extra skin to relieve some of that heaviness. So different approaches on the same patient. Hope that was helpful. Let us know if you have any questions. Thanks.